Hi, welcome to my YouTube channel. Today I have a very special guest with me, Dr. Mohammed Al-Azani, who's a vascular surgeon, and he is not only perfect in what he does, but he has a very good cause he's been working for. We will discuss that and much more in this video. Hi doctor.
Hello, nice to meet you.
Dr. Mohammed, you have been doing vascular surgery in Europe, and I've heard about plastic surgery, cardiac surgery, orthopedic surgery, but I want to know more about vascular surgery.
Basically, vascular surgery is related into repairing the arteries on the body and also the veins. In Europe, most of the patients that we actually receive are minimum above 50 years old. So basically what we do in the vascular surgery field is we focus on repairing the vessels of the body. We can do it open surgery and we can also do it minimal invasive endovascular surgery. We don't just focus on the vascular surgery itself, we also focus on diabetic patients because the diabetic patients, they end up having polyneuropathy, they have problems with their vessels, where they have blockage in their vessels. Therefore we have to intervene and either do an open surgery or a minimal invasive surgery. Some of the patients that have diabetes, they end up developing wounds on the feet or on the extremities, and because of the diabetes and lack of blood flow on the extremities, the wound doesn't heal. Therefore they come to us, and that's why we do investigation, do MRI, endovascular angiography, to find out what is wrong with them. And when we see there's a blockage in their vessels, then we can either open it with a balloon, we can put a stent in there. Worst scenario is we end up doing a bypass.
Okay.
Yeah.
So mostly the kind of cases we are talking about who come to you, are they diabetic or they are from?
Not mostly. We have patients that are diabetic. We have patients that have a high risk of cardiovascular disease,
Okay.
which are smokers. We have patients that have high cholesterol. They come to us, and also patients at old age, because of the vessels within age, it starts degenerate, building plaques, and therefore we have to be.
So, doctor, it's a very basic question. I'm not a doctor.
No problem.
Right. So is it more related to blockages in the veins?
Exactly.
Yeah.
Yes, because the plaques, the buildup of plaques, come mainly from cholesterol or the diabetic patients because of the sugar, the glucose,
Right.
and it enters the intima of the vessel, and it damages the vessel as well, and it leads to blockage or even narrowing of the vessel, and that is the most problem that these patients face.
Okay.
It leads to a lot of complications. It can also lead to a complication where you have to amputate the patient, where you have to amputate the leg.
Oh my God.
You can either amputate it under the knee, above the knee, or on the hip.
Okay. And mostly, as you said, it's diabetes and cholesterol. That is the main.
These are the risk, the high risk factors are cholesterol, diabetic, smokers. These are the main high risk factors, and the age as well.
And what does the patient feel generally when he needs to call up a vascular surgeon?
Okay, so basically it has many stages. Yeah, first of all, with diabetics, they don't have a feeling because they have damage on their nerves, which is polyneuropathy. Therefore, you see most of the diabetic patients, they come to you and they already have an infection on their toe or their small toe or on their feet because they've had an injury, and because they don't have a feeling, they don't feel it. And some of the patients, they come to us with a nail inside their toe because they didn't feel the pain, and because of the infection and lack of blood flow, they end up having an infection, and we have to intervene by fixing the vessels. And at the same time, if the infection is so severe that we have to amputate the toe or we have to amputate the foot, then we'll have to. The other thing as well, the stages of peripheral vascular disease are, first of all, one of the patients, we call it the stage A, 1A, which is they can walk up to 1 kilometer without having any pain, but they have blockage in their vessels, but it's not that bad. 2A is they can walk up to 500 meters without any pain, and then it starts the pain on one leg or the other leg. The second one, which is B, 2B, is their maximum capacity of walking is 200 meters, and then they start feeling pain. They feel pain on the calf, or they feel pain on the extremities on the thigh. These patients, we try to either do endovascular surgery, or if we do a bypass, it will be femoral bypass to popliteal bypass.
Okay.
We try our best not to go below the knee, because it will lead to more complications. But we have also patients who feel pain while even without walking.
Okay.
This is level 3, and these patients we can also do bypass under the knee, so it's not a problem. And level 4 is when they come and they already have a wound on the feet or on the lower extremity.
And it's not healing.
That's not healing, and it takes time. Some of the patients, they end up going to a dermatologist, and the dermatologist provide them with creams and try to heal the process. And some of the patients go to a general surgeon, and the general surgeon doesn't have the ability to diagnose vessel surgeries. So some of the patients, they end up coming to us, they've already got an amputated toe, and without knowing the main cause of this problem.
Yeah. So it is scary actually. So like I think one has to visit, because most of us don't know who to visit if you feel such symptoms.
Yes.
So the patients you are seeing are generally younger patients, or
all the patients mainly above 50 years old.
Okay.
We don't just do vascular surgeries on the extremities, we also do vascular surgery on the carotids.
Okay.
And we also do vascular surgery on the aorta itself.
What is carotid surgery?
The vessels
face.
on the
Face.
No, the vessels on the neck.
Neck.
Yeah.
Okay.
Say for example a patient has a stroke.
Right.
Yeah. There's many factors that can lead to a stroke.
Okay.
There's atrial fibrillation. There's also a blockage on the vessels of the carotid artery.
Okay.
Yeah. This is the part of our work when the patient comes to us with a blockage on the carotid artery. Therefore, we have to do an open surgery. There's also surgeries where we endovascular surgery where we put a stent on the carotid artery because it reopens the vessel and it brings more blood flow to the brain.
Right.
The risk of endovascular surgery in the carotid artery is stroke.
Okay.
Because one of the plaques can fly up.
Right.
And it can lead to a stroke. This is why we prefer mostly open surgery. It has less side effects as a stroke, but it's also it's an open surgery.
It's a surgery. Yeah. True. So I want to know more about where you're practicing now and what you're doing. I went through your documents, and if I understand, you have a British and a German background.
Exactly.
So tell me more about that.
So basically, I'm originally from Yemen. I left Yemen in 1994 when I was 10 years old.
Right.
I lived in the UK. Because my mother is British, and we went to the UK because my grandfather left Yemen in 1940.
Okay.
So he was working in the UK, and that's how we ended up going back to the UK. So basically, I lived most of my life in the UK. I studied in the UK. I also worked in the UK. I did biomedical science bachelor, and then I did analytical bioscience master degree. I worked in the hospitals over there. I studied medicine after that. And then when I finished medicine, I worked as a local doctor in the UK. And because I wanted to get into a surgical field, and in the UK is very competitive. So I moved to Germany. I took my family and we went to Germany without knowing anyone over there. So it was basically a fresh start. Went to Germany, started learning the language.
Yeah, it's a totally different language.
It's English and Germany is like between the.
And you did your master's in German?
In the UK.
In the UK.
Yeah. Okay. After learning the language, I got my license to practice as a doctor, and then I got a job in the cardiac surgery. So I entered the cardiac surgery field where we were specializing in cardiac surgeries.
Right.
So I did that for 6 years and a half. I completed it. It was severe work because you had to do a lot of hours. You had to do a lot of 24 hours shifts. And then after that, I decided that I wanted to basically open my own clinic. And in the cardiac surgery, you can't open a clinic. You have to actually work in the hospital. It's a big operation. It's not small. And the next best thing was vascular surgery.
Right.
And this is why I decided to enter the vascular surgery, because vascular surgery has many fields. You can open your own clinic, you can work in the hospital, you can do a lot of things in the vascular surgery. You can do endovascular surgery. With cardiac surgery, mostly are all open surgeries. The only thing that you can do with cardiac surgery is cardiology, which is endovascular, where they do heart catheters. This is one of them. And this is why I started doing vascular surgery. I enjoyed it. It was very interesting. Made me more independent because I was doing a lot of operations myself. And one of our professors, or our professor in the vascular surgery, he's one of the best surgeons in Germany. So learning from him is a positive outcome that can help my future in the vascular surgery, because he is, I would say, one of the best surgeons in Germany.
Right. And so you practiced in Germany and you didn't go back to UK after?
No, I didn't go back to the UK because I found the knowledge and the experience that I am earning in Germany was much better, because I am hands on surgeries. I'm in the UK going back into this field, which is quite interesting, but it requires a lot of work, and it requires a lot of paperwork and bureaucracy, but mostly, and the other thing as well, comparing the UK and Germany. In the UK they have the NHS, which is the general health system, where everybody don't have to pay for the health service. In Germany, everybody has insurance, so the insurance pays for everything. So in the UK, there is criteria where they have to meet. Say, for example, a patient is particular age, where the NHS says we're not allowed to do an operation on this person because it costs so much. But in Germany, there's no age limit. It's all related on the patient and what the patient needs. So they focus more on the patient rather than the money. And this is why I preferred the German health system compared to the UK.
They're serving more the patients.
Exactly.
And I met you in Dubai, so not met you in Germany or UK. And the reason we met is that Dr. Mohammed wants to expand his services to this part of the world. Being an Arab at heart, definitely you need to be here. But what was the turning point in your life that motivated you?
That motivated me to come here.
Yeah.
First of all, I came here as a holiday. 2 years ago, and I came with my family. And my family loved this place. I loved it as well. First of all, multi-cultures. There is a lot of respect that you get in this country. No matter what background you come from, you will be treated like a human being. And whether you're wearing a certain type of clothes or you're not wearing a certain type of clothes, you are treated equal as a human being in this country. You can practice any religion you want here in this country, and you have the freedom to live your life in the best way you can. And the other thing that I loved about this country, I would say from my own experience, from what I have seen, I would say that United Arab Emirates is the safest country in the world.
It is.
Where you can leave your kids in certain places, you don't have to worry.
Definitely.
In Europe is a nice place to live, but it's become dangerous. You know, there's people that will kidnap your children, theft, robberies, attacks, and all of these things that are happening in Europe that you will never ever in your life see here in the United Arab Emirates. This is one of the main reasons why it made me think I need to look after myself, my future, and the future of my kid, because I need to make sure that when I concentrate on my work, that I'm not sitting there worrying about my family. or my kid.
Right.
And this is the country where you can do, you can concentrate 100% on your work, not worrying about your family or your kids or what's happening with your
Sure.
yeah, because this country protects you
Yeah.
and your family.
So it gives you that peace of mind.
Exactly.
Yeah, and that's the beauty. In fact, really touched the right thing. I've met a lot of people, and what you said is beautiful. That you can be yourself,
Exactly.
and there is respect. So first time I heard this from someone, which is so true. So I think that's somewhere part of the Middle Eastern Asian culture, and it's really beautiful in UAE. So what are your immediate plans now, doctor?
My plan is to open a clinic here
Okay.
in Dubai, and with God's power to expand as well. Not just in Dubai and also other Emirates. And I want to bring my expertise that I developed in Europe and bring it here and try to benefit the people of Emirates and the people that are living here. This is my plan, and also to bring my family here so they can go to schools here and build their own future, because every human being has their own future.
Right.
And I just want to help them build their own future in this.
And I was talking to Dr. Mohammed and we meeting each other for past 1 week, and I heard a lot of stories about how you were brought up by your father and your value system.
Yes.
And how your culture and your values help you to make the person you are. But other than that, you also spoke to me about a charitable organization which is very close to your heart. So I would love to know more about that.
Basically, because I'm originally from Yemen, and the war started in Yemen 2015, and I know a lot of people in Yemen since I was a child. For when you live in a European country and you have everything in your hand, you don't have to worry about food, and you don't have to worry about accommodation, you don't have to worry about all these things. And then you hear some of your childhood friends, some of them lost their lives, where they have their children. Their children have become orphans, their wives have become widows, and seeing the catastrophic effect that this war has done to my country, I wanted to do something for my country. I wanted to do something human to help the people of Yemen that are struggling to find food to feed it. So the way I started it was in Germany, and basically what happened, my grandmother who still lives in Yemen, she called me and she told me that one of my friends, Ahmed, who was my childhood friend, we used to go to school together when I was in Yemen, he passed away with his brothers, and he left 4 children orphans. He wanted to go to register his kids in school, and a rocket came and blew up the school and he died, and that affected me a lot. And because I've known him since I was probably 5 years old till I was 10, and we always used to keep close contact, I felt for his children because he was the only family provider in that family. So I made a promise to my grandmother that I will look after his children, I will sponsor all his children, and I will look after his family for the rest of my life. And because I started this process, I've noticed that more people are in need of help.
Right.
So I started talking to my colleagues at work because of the war situation. They started helping. People started donating, giving me money. So I started sending it to Yemen, and then we started giving it to the poor people. And because it got so big, I decided I think the best thing is to open a charity. So I applied to the Charity Commission in the UK to open the charity, and luckily we got accepted, and that's how it started. We started working on the charity. Even though I'm a doctor, I used to work day and night as a doctor, and I have family. Putting this charity on top of my head was also a workload.
Right.
But the motivation that I had and seeing the poor people, especially when you see poor people searching the bin to look for food to feed their children, it gave me a lot of motivation and courage to work and to have lack of sleep to make sure that these people have in their house to feed their kids. And with God's power, this charity developed, and it became more noticeable, and it became more big, and it started spreading around the world, where we have donors from the UK, from Germany, from all European countries. We have donors from the USA, we have donors from Canada, from Australia. And because we built a lot of trust, we also had charities from the UK and America and Australia and European countries coming to us to do projects for them, because most of the charities that are like local charities that are doing projects for outside charities, they charge them a commission. Yeah, we don't do that because our charity is registered in Yemen and it's also registered in the UK. And our aim is to limit the cost, therefore we can target more people and we can help more people. And this is why we don't charge any charities any admission cost or any charges when they help us to help the people of Yemen, because we see that the more people that help, the more people we end up saving. Yeah. And also, one of the things that I also introduce in the charity is the medical, which is very close to me, and that way I can monitor it a lot. And the reason why I introduced the medical field, the medical aid to the charity, is because from my own experience, my uncle passed away in Yemen from Corona, from COVID, because they had lack of medical facility. That was the reason why, obviously, your time is written from God, but to know that because of the medical facilities that they had, a person can die, it affected me a lot. And this is why I focused also on the medical field or the medical aid, help the people that are in need of medical aid, financial, to do operations for them. We connect with hospitals over there to make sure that people that are in need, they receive all the medical aid that we have saved with God's power a lot. There was one particular child, this child destroyed my heart. 1 year, he was 1 year old. He had a problem with his kidney, and because of the blockage in his ureter, he was unable to urinate. For that first year of his life, this child was suffering. Child was crying every day. The child was always in pain, and his family was so poor that they didn't have no money. They didn't have no accommodation. They were living in a room that was made of like stone. There was nothing. They didn't have no money for food. They didn't have money for nothing. So basically, the story from the mother, this story came to us from the mother herself. She said her child was always crying every single night because he couldn't urinate. And they used to go to the doctor because they didn't have no money, and the doctor used to tell them that this child needs operation, and because they didn't have no money, the amount of money that they had was only enough to buy him painkillers, just to remove the pain, that's it. So the doctor told them this child will not live beyond 1 year or 1 year and a half if he carries on like this. Thank God, one of a particular friend found us, and this particular family came to him asking him for help, and he contacted me that, and he said this is the situation with this child. So I contacted the family, took all the medical report, I checked what's wrong with him. So I told the team in Yemen to rush him to the hospital in Sana'a, the capital city, and to do all the diagnostics, everything that he needs. So they did everything. His right kidney, he had kidney failure. So we spoke to the surgeons over there, and the surgeon said we have to do 5 operations, but we can only save 1. This is a 1-year-old kid. So I told the doctor, do what you need to do, because this child needs to. So this child ended up having 5 operations in a period of 1 year. Now this child plays, 3 years old. He plays, he's starting to talk, he's starting to walk, he goes toilet normally like other children. And she changed the name of that child from Yusuf to Faris, because Faris is our team member.
Beautiful.
And he was always in contact with the family. She went and she said, I'm going to change his name from Yusuf to Faris.
Beautiful.
Just because of what you've done,
Yeah.
because you saved this child's life.
God bless you, sir. God bless you and your whole team and the cause you're working for. Hopefully all the good people in the world unite and join your cause.
I hope so.
So coming from this heart-touching story, and I think that can be one of the turning points for most of us to get involved in good cause. And going forward from here, now you are in Germany and you are expanding, setting up a clinic here. So what's your vision for being in UAE?
Basically is to bring the expertise that we have in Europe and bring it here, UAE, to open a clinic and also to expand in different Emirates as well, and to see how much we can do for humanity also in this country. Because from what we've seen, this country has done a lot.
Yeah.
To help a lot. This country has developed in a short period of time and it's become one of the best countries in the world. You know, the history of this country within a period of, say for example, 50 or 80 years is skyrocketing. And the vision of this country that they want to increase and develop even more, and I want to be part of this. This is why I want to come to this country to be part of this vision that they have developed, and also to see what I can do for this country, so see what I can do for the people that are living in this.
God bless the UAE, because every morning, honestly, I get up and thank the leadership to give us such a place to stay in, and I feel blessed to be here. Doc, I want to come back to your clinic. I want to know what kind of a clinic you want to set up here, and what are the services you will offer, who will be your clientele, and who should contact you once you are up and running?
Yeah, so basically we're going to be focusing on vascular surgery and diabetic foot syndrome. So patients that are suffering from diabetes, they have problems with their vessel, wound. We're also going to focus on patients having vein chronic disease with wound infection. We're going to try to also generalize the work in the medical field for in our clinic as well, so we can focus on connecting with the cardiologist. We need to connect with the dermatologist. Therefore, we need to build our network. We also need to connect with some of the hospitals here in order to perform major operations, because the clinic that we're going to open, we won't have the capacity to do big operations. Now for our clinic, we need to focus on the diagnostic, where we diagnose patients that have vascular disease, diabetic foot syndrome, venous disease, and also the patients that are suffering from strokes or that are suffering or high risk of suffering from stroke, the people that are suffering from cholesterol, because cholesterol normally leads vascular disease, whether it's in the heart or around the body. And this is what we need to focus. And also the other thing as well, emergencies, you know, say for example somebody has a car accident, it can also lead to vascular damage. This is why we also need to intervene on the follow-up, because obviously if a person has an emergency, we'll have to go to the hospital, see if the emergency surgery, but the follow-up to be done in a clinic. He doesn't need to go to the follow-up to make sure that everything is okay.
I feel that Dubai definitely needs advanced clinic which can offer vascular procedures. The purpose of this video also is to educate a lot of people, because even myself, I am learning a lot while talking to you. I had less information about vascular surgery, and I'm sure it will add value to a lot of people, and they will consult a vascular surgeon. So futuristically, in few months, you have a vascular clinic running in Dubai, and hopefully you will be catering to the people here and serving them with your expertise. And do you want to give a message to all your friends in Europe who want to further expand in Dubai? Your colleagues.
So basically, to all my colleagues and to everyone out there, opening a clinic or even working in Dubai, I think is the best thing that anybody can ever do. Because first of all, the environment that you're going to be living in, it doesn't matter what background you come from, you will be respected like a human being. The other thing as well, the bureaucracy, all the paperwork and everything that we have to deal with in Europe, you're not going to have it here. The amount of tax that we pay in Europe, where we have to work day and night, sweat every single day, working so hard and ending up paying 50% of our income, of our hard work, to tax. And even the rest of the 50% that we have, when we go and buy stuff, we still have to pay tax for that as well. You don't have to pay that here in the UAE. So your hard work and your income that you will be receiving, you will receive that 100%. The safety in this country for you and for your family is undescribable. We've lived in Europe, we've faced racism, we've faced a lot of problems, we've been attack, verbally, discrimination, and even our children have come home and they've been discriminated in school from kids. This is not the way of life. The way of life is to be treated as a human being and to be treated equally, no matter what background you come from, what religion you believe, or even if you don't believe a religion, you are a human being. At the end of the day, our blood has the same color. You will only see this in this country. You're not going to see in any European country, no matter how developed the European countries are, you will always face discrimination. And this is why I think, from my point of view, in the future, all my colleagues and everyone out there should start planning to come to this country.
I agree completely. It's a beautiful country to be in. You started from UK, went to Germany, started an organization to serve others. Now you are in Dubai, setting up a big clinic here. So let's say 30 years down the line, when you look back, how would you like to retire?
I will have to do what I need to do to serve the people, and so you will always continue working for the rest of your life. The only thing is you reduce the amount of work or the workload that you normally do.
So on that beautiful note, help others. That's what I learned from Dr. Mohammed and his beautiful journey. And God bless him for the work he is doing. There's lots to learn in this video. Thank you, Dr. Mohammed, for joining me. It's been a pleasure. Thank you.
You're welcome. It's been my pleasure as well.
Thank you.
Nice to have you.